There are two big impacts. So we're in October of 2024 right now. For 2025, some of the changes are twofold. The pandemic funding has expired. It's run out this year. So because of that, a lot of the insurance companies that were getting an extra funding behind the scenes from Medicare to keep them afloat during the pandemic, that funding has expired. So because they're lacking some of those funds, we're seeing a lot of rate increases go up to you. I mean, unfortunately, they've lost these funds, so they're going to come to you for either higher premium or reduced benefits.
Well, hello and welcome to Uncommon Knowledge for Seniors. I'm your host, Jim Moran, a realtor and banking executive with over 35 years of experience. This podcast is your go-to resource for navigating the complex world of real estate and senior living transitions. Each week, we'll dive into topics and resources that matter the most to you, from retirement communities, real estate planning, reverse mortgages, trusts, memory care, elder abuse, and more. And whether you're a senior, a family member, caregiver, or real estate professional, we're here to provide you with the most valuable insights and practical, trustworthy advice from some of the best experts in the business. Thank you for joining us, and let's get started. Well, hello, and welcome to another episode of Uncommon Knowledge for Seniors. Today we have again Michelle Thomas. Michelle's a great Medicare insurance broker, and there's been some big changes, and we had a previous episode where she kind of explained what the process is for the policies themselves. But these changes are big, and people need to know about it. It's getting out in the news, I think, quite a bit. But at the end of the day, you need to be on top of your policy and find out what's going on, and frankly, whether or not you even have a policy. So. Michelle, thanks for being here today, and what's going on?
A lot, sir. Thank you for inviting me. Thanks everybody for listening again. I know Medicare isn't a terribly sexy topic, but this is the time of year. If you only pay attention to what you have in place in terms of coverage once a year, this is the time. We are right now in the Medicare, they call it the annual election period. So it runs from October 15th through Pearl Harbor Day, so through December 7th. A lot of times it's called the open enrollment period. This is when we make changes to your plans for next year. And I'm really encouraging folks, and I know Jim's podcast is going out through multiple regions. So regardless of where you live in the United States, now is the time to pay attention to your mail and just make sure, if you open nothing else in terms of all the solicitations, I know you're getting marketed by everybody. If you only open the piece of mail that comes from your specific carrier, so let's say you have Blue Cross Blue Shield, make sure to open that piece of mail to make sure that you have coverage in place for next year, because that notification is where they tell you your premium went from $4 to $50, or we're dropping coverage in your area next year and you need to find an alternative. So there's a lot of moving parts right now.
So when you get that letter, and I would assume they're all different, but do they offer you an alternative? Do they say, here's what is there like another version of a policy that they may have that they'll say, you can't do this one, but you do that one? Or is it just no, we're just not doing it?
It's typically no. So if they're dissolving a plan in your area, they may have alternative plans, but oftentimes Medicare doesn't allow them to, it's called crosswalking. So take you from this plan to this plan. Typically, they're not allowed to do that behind the scenes for you. They want to make sure that you're participating in that decision. So you're going to get, I call it a Dear John letter, where they break up with you for next year. That letter is worth its weight in gold. That letter gives you the flexibility to enroll onto any plan you'd like for the following year. So make sure you keep that. And if you go at it alone, if you don't have a broker, I would say, especially if you get a letter like that, reach out to a local Medicare broker in your community and let them help you, because it can be overwhelming. Hopping onto Medicare.gov is a fantastic resource, but again, it's a lot to digest. So reach out to an expert in your community and let them help you.
Well, I know we talked earlier about some of the reasons And I guess it really doesn't matter, right? It's just they're going to do it. Insurance has kind of been an issue with everything. I think homeowners and policies are getting canceled
Right.
and all that. It's just, I guess, not as profitable as it always used to be. But um, what are you seeing as changes to the, like, say, the policies that you have or that are in place and are working? What kind of changes are you seeing in that venue?
So there are two big impacts. So we're in October of 2024 right now.
Mhm.
For 2025, some of the changes are twofold. The pandemic funding has expired. It's run out this year. So because of that, a lot of the insurance companies that were getting an extra funding behind the scenes from Medicare to keep them afloat during the pandemic, that funding has expired. So because they're lacking some of those funds, we're seeing a lot of rate increases go up to you. I mean, unfortunately, they've lost these funds, so they're going to come to you for either higher premium or reduced benefits next year. One impact that's changed that's really beneficial for a lot of clients, the Inflation Reduction Act is kind of kicking in a big way in 2025. So to give you an example, this year in 2024, if you were on a lot of brand name medications or a lot of really expensive medications, you could have spent up to $8,000 per person per year out of your pocket for your medication costs, not your medical, just your drug costs. Next year, that reduces. So that's going to go from $8,000 to $2,000, which is fabulous for a lot of clients and take a lot of expensive meds.
Yeah. So that starts what, first of the year? So
First of the year, and it's a great benefit, but that comes at a cost also, because they're slashing your out-of-pocket max by 75%. And because of that, we're seeing some increases, in terms of premiums go up or reduction in drug formularies. If you're on a lot of expensive medications, I would hop onto Medicare.gov. There's an opportunity on there. It's called a drug or a plan finder. Click on that and put in your medications and just take a look and see if your plan is even available to you next year and if it's still a good option. Because this time of year, the drug plans have an opportunity to change their drug formulary, meaning the medications they cover. So you might have had Eliquis covered this year and it may not be covered next year, or it might be in a different tier, meaning it's not covered the same way next year.
geez, it's just not simple, is it? So what do you think's driving this whole thing? I mean, have you seen something like this before in the industry? Has there been kind of like wholesale changes that we're seeing now?
It's getting more volatile. I guess that's what I would say, that it's becoming, everything is down to an nth degree in terms of contracting. So what the carriers are able to contract with your local hospitals or facilities. And also on the drug plans, they're not playing nice anymore. They don't want you to go to the small mom and pop pharmacies. They want you to go to Costco, Safeway, Walgreens. They want you to go to the bigger ones where they have just better purchasing power. It's a disappointment because a lot of folks like going to the small mom and pop pharmacies, and that's just, unfortunately, that's kind of being phased out.
Um, You know, you just kind of hope that this stuff's going to get better and not worse, and with all the people turning 65 and, but that's probably part of the issue too, right? I mean, it's just a matter of demographics and there's more people using the system and it's just getting stressed, I guess. Um, what else are you seeing that folks should know about?
Well, to your previous point, you are spot on. So we still in the United States, there are 10,000 people a day turning 65 because we're still in the boomer phase. So
That's gonna help.
10,000 people a day.
We're not done.
That that is wild. No, we're not done. I think we still have another 4 or 5 years. But the other piece to this specific chunk of time, October through December 7th, um, everybody in the United States has 56 days to change their plan for next year, which I don't know who came up with that timeline. I can't tell you. I mean, the constraints on it are tricky. We here in this office, we only work with Medicare, so we live and breathe it. We don't do any other types of coverage. And it's a struggle making sure you get in front of everybody and talk to everybody and make sure their plan is still where they need it to be for next year. So, boy, get started early. Don't wait till the last minute.
So they'll be covered during that period, right? That if they have an existing policy that's going away, there's at least they're not going to lose it during the period while they're trying to find something.
No, typically, so Medicare protects you, but you have to open your mail to know what's changing. Medicare takes really good care of you and make sure that you always have opportunities to change plans, but you have to know you're losing a plan to replace it. And yes, Medicare typically runs on a calendar year. It's very unusual to have mid-year changes. So typically anything you have now runs through December 31st, and any changes you make now apply the first of the year.
Wow. just amazing. It's well, thankfully there's folks like you out there that they can get in front of, when you have time. Good gosh, what an issue. Well, thank you for this. And we'll have to get this out a lot in front of folks. I know we've been doing a lot of work with the Council on Aging and folks like that, but this is the time to know about this, for sure.
It is. Well, and as you mentioned, Council on Aging, or SHIBA, the Senior Health Insurance Benefit Advisors, they're local, they're free, they're staffed by volunteers, and they're folks, they're not brokers, so they can't advise you and give you a lot of direction, but they can help you run your list of medications. If you're uncomfortable going onto Medicare.gov, or if you don't have the patience for the technology, totally get that. But there are resources out there that can kind of help you navigate that.
What's a good number to get a hold of you folks?
We would love to chat with you. So we are 541-388-3333. I'm extension 1. There's 3 of us on there. Feel free to leave me a voicemail, and if I'm unable to get right back to you, I'll have either Kelly Schroeder or Michaela Bullock. There's 3 of us in here that all do the same thing, and we're going as fast as our fingers can type and our mouths can flap.
That's good to know you got some backup.
We do. And thank you for this. This is, I mean, like I said, it's not a sexy topic, but there's a lot of changes. So thanks, Jim.
Well, thank you for this.
Yeah.
Take care. Thank you for listening to this episode of Uncommon Knowledge for Seniors. I hope you found the information valuable and inspiring. And if you have topics or circumstances you'd like us to address, please let us know. And don't forget to subscribe to our podcast and visit our website. We're at www.uncommonknowledgeforseniors.com for more resources and schedule a confidential consultation. And until next time, I'm Jim Moran, reminding you to embrace your next chapter with confidence and clarity. Take care.